Hey everyone, welcome back to my channel. Today I'm going to be talking about the Marburg virus. This is a rare but deadly virus that can cause hemorrhagic fever. It's spread through contact with infected bodily fluids, like blood or saliva. In recent months, there have been outbreaks of the Marburg virus in parts of Africa. This has led to concerns about the virus spreading to other parts of the world. As of November 2024, there have been 66 confirmed cases of Marburg virus disease in Rwanda. 15 of them have died. In this video, I'm going to discuss what the Marburg virus is, how it spread, the symptoms of the virus, and what you can do to protect yourself. I hope you find this video helpful. What is the Marburg virus? The Marburg virus, also known as bleeding eye disease, is a rare but deadly virus that causes hemorrhagic fever. Hemorrhagic fever is a disease that causes bleeding from the eyes, nose, and mouth. The virus is spread through contact with infected bodily fluids like blood or saliva. The Marburg virus has a high fatality rate. The average fatality rate is around 50%, but it can be as high as 88%. How is the Marburg virus spread? The Marburg virus is a highly contagious disease. It can spread through contact with the blood, saliva, sweat, urine, vomit, or feces of an infected person. It can also spread through contact with contaminated surfaces or materials. The virus can enter the body through the eyes, nose, or mouth. The Marburg virus is a filovirus, which is a type of virus that gets its name from its thread-like shape. Filoviruses are related to Ebola viruses. Both viruses cause similar symptoms, but Marburg virus is generally less contagious than Ebola virus. What are filoviruses? Filoviruses are a family of viruses that are known to cause severe diseases in humans and other primates. They are named for their thread-like appearance under a microscope. The most well-known filoviruses are Ebola virus and Marburg virus. Both viruses can cause hemorrhagic fever, which is a condition that causes bleeding from the eyes, nose, and mouth. What are the symptoms of the Marburg virus? The symptoms of the Marburg virus can vary, but they usually include fever, headache, muscle aches, severe watery diarrhea, abdominal pain and cramping, nausea, and vomiting, rash, bleeding from the eyes, nose, and mouth. These symptoms can be severe and can lead to death. What can you do to protect yourself from the Marburg virus? There are many things you can do to protect yourself from infection. Avoid contact with infected people or animals. Practice good hygiene, such as washing your hands often with soap and water. Avoid touching your eyes, nose, or mouth. If you are traveling to an area where the Marburg virus is present, be aware of the symptoms and seek medical attention immediately if you experience any of them. It is important to note that the Marburg virus is a serious disease, and it is important to take precautions to protect yourself from infection. If you are traveling to an area where the Marburg virus is present, it is important to be aware of the symptoms and to seek medical attention immediately if you experience any of them. There is no specific treatment for the Marburg virus. However, supportive care, such as fluids and electrolytes, can help manage the symptoms. There is no vaccine to prevent the Marburg virus. However, there are several experimental vaccines in development. The healthcare response to the Marburg virus is focused on containment and supportive care. There is no specific cure for the virus, so treatment focuses on managing symptoms and preventing complications. This includes isolation, Infected patients are isolated to prevent the spread of the virus. Supportive care. This includes fluids, electrolytes, and blood transfusions to help the body fight the infection. Infection control. Healthcare workers take precautions to protect themselves from infection, such as wearing protective clothing and using proper hygiene practices. The World Health Organization (WHO) and other health organizations are working to develop vaccines and antiviral drugs to treat the Marburg virus. However, these are still in the early stages of development. If you enjoyed this video, please give it a thumbs up and subscribe for more. Don't forget to hit the bell icon to stay updated with our latest content. Thank you so much for watching.